So I'm going to go ahead and get started. Thanks everyone for being here. I'm Beth Blauer. I'm the Executive Director of the Center for Government Excellence here at Johns Hopkins. We're part of the Krieger School of Arts and Sciences. We're a brand new facility here on campus. Well, brand new. We're now 3 years old. I'm joined today in my presentation with my colleague, Kat Klosek, who will be joining while we talk about some of our case studies. But I was going to just give you a little bit of background about me to get started, and then just to sort of position myself, and then we're going to talk a little bit about the work that we're doing at GovEx. So my first job in government was as a juvenile probation officer. So I worked out of law school in first Montgomery County, Maryland, and then in Baltimore City in the juvenile justice system. And in that work, became a great observer of some of the distress that's put on frontline workers in government when they don't have access to data. So I was asked in that job to really think about whether or not children and their families could maintain the family intact while the adjudications were happening. So children would be charged with offenses, and during the time that their cases were moving through the court system, I was asked to make the decision as to whether or not they should stay home or whether they should be in one of the state funded care facilities. And I had to make that decision with virtually no information about the family. I didn't know whether or not there were social workers involved in that family's life. I didn't know whether that child had been in school the day before the offense. I didn't know whether or not that child was receiving any of the social safety net services that the state was providing. And even though we were all working for the same organization, I was in a situation where I was making a very tough decision in a very vulnerable moment for that family with very little information. And so I became a very outspoken advocate of interagency information sharing. And at the time, I was also moving up through that organization. So when Martin O'Malley was elected governor of the state of Maryland, I was working in the secretary of the Department of Juvenile Services office. And the concept of STAT sort of emerged. And so I was responsible for preparing the Department of Juvenile Services for performance STAT. Or first for the state STAT initiative. And so I'm going to talk a little bit in more detail about what state STAT was and what we did at the state level. But I just want to give you sort of an overview of my experience. And so I was at the state in sort of the de facto chief operating officer role, oversaw about 85% of the state's budget in that role and a comparable amount of the workforce. And then I moved into the private sector where I worked at a software startup. And then I spun into the position I'm in now, which we'll talk a little bit in detail about. So I know that there are many of you in the room who are familiar with state STAT and with the role that I played in helping to manage the state through this data-driven initiative. But I'm going to give just a little bit of background. Sort of conceptually, the idea around state STAT is that the governor really did want to mobilize data as a strategic asset and to start really thinking strategically about not only how data was being collected in individual agencies, but how can you get an enterprise view of the state using data and really think differently about the way that you are solving your problems. And so not only were we standardizing the way that data was collected in different systems and across different agencies, but we were also creating a tiered system of outcomes that were really important to the people that were not only running the different state agencies, but living in the state of Maryland. And so we worked very hard on aligning this data that we were collecting over time to those outcomes. So if you think about the things that we were measuring at the time, we were measuring a whole set of education outcomes that led to some really great benefits for the state. So we were looking at whether children were coming into school ready to learn. We were looking at time and attendance, making sure children were staying in school, whether or not we were penetrating our school lunch rates. We were looking at health outcomes like infant mortality at the state level. There were a lot of different outcome indicators that we were collecting data from across the state, and we were having these really guided conversations by the data in the room with the governor and the senior team, really directed at trying to figure out what are the ways that we are making progress on these goals. What's the data telling us on the efficacy of interventions? We are measuring new ideas, seeing whether or not they were paying off. And we were trying to really get a feel for whether or not the efforts and the investments that we were making were actually proving to be effective. And they were, and we were able to do some really great work. But as we've seen, there's been a shift in the way that governments have been operating because of the availability of data, the ease of getting data. Systems are producing data at different rates, but also the way that data can be used has also changed over time. So when O'Malley started at the city level, at CityStat, it was a lot of low-hanging fruit. There was a lot of things that could be done that could sort of quickly be resolved by just actually looking at data and information. And at the state, there was also a lot of low-hanging fruit. There was waste that was identified. There were different ways that you could attack some of the operational inefficiencies that we were observing in agencies. But as we have seen the practice of performance management in government evolve, we've seen that as data has become easier to access, as data has been more plentiful, depicting problems in different ways, that there's been a need for sort of a radicalized change to the way performance management has really evolved. And so we've been working at the Center for Government Excellence on rethinking the way performance management in government is really evolving, and taking sort of the best practice that we've learned through a lot of our experience in the traditional performance stat, and thinking about how analytics and really how math can layer into the work that we've been doing from a performance perspective and the merge of performance and analytics. So what does it look like when you get to the point where you have sort of gathered all of the low-hanging fruit, and now you need to start making hard decisions around new practice areas, new policy areas, new investments in problem solving. And so we think about this overlap, and the work that we do at GovEx is really around creating that practice in the overlapping area here. And so when we think about analytics, we think about analytics from a really sort of dynamic perspective. But we also are working with people who have not really been exposed to a lot of analytic work. So our target audience in the work that we do, particularly at GovEx, is really with government practitioners, so people who work at the mid-level management in agencies that have been really sort of program-driven. So we're not talking about people who have deep analytic expertise. And so we are taking them through essentially sort of democratized versions of analytics training in order to help them understand how they can scope some of their most entrenched problems in a way that will enable analytics. So I imagine that many of you who are thinking about careers in public health will be thinking about the same kind of approach when you're going into working with your local health departments, with your external stakeholders in problem solving. How can you get them to start thinking about the ways? And so in this slide, we're talking about sort of the methods that we're using as we're going through the process. So we use 4 key kind of approaches in our analytic methods in sort of what we are calling sort of the modern performance management, and they span across the across these sort of 4 zones. So descriptive analytics, diagnostic analytics, predictive analytics, and prescriptive analytics. But if you see, we use a really democratized example in the slide, so you can see that we're using something that people can identify with. So a driver knows there's traffic jam because you're actually stuck in it, right? So you're there, you're experiencing it. You have anecdotal information, or you have a firsthand experience. The diagnostic analytics that so why has it happened? Traffic reporter tells listeners the traffic is due to an overturned truck. So you know what that sort of instigating intervening issue is. And then we're working with a number of governments on how do you actually turn this information into prediction, right? So predictive analytics, Google Traffic uses a color. So when you're in your car, you now know that in 10 miles, you're gonna hit a traffic jam, that you may be rerouted to avoid that traffic jam. You may be able to find a secondary route, or you may be able to opt into another mode of transportation. And then from a prescriptive perspective, ways will optimize your route before you start, and will continue to optimize it. So how can you think about that in your own practice? Are you optimizing? Are you are you building evaluation into the beginning of your programs? Are you listening to what your evaluators are saying to your programs? And then are you letting it influence the course that you're taking? And so these are skills that do not come innately to a lot of the public sector partners that we have in cities. And we'll talk a little bit about what our partnerships look like. But this, at its core, is sort of what we're trying to do in terms of building the capacity of the public sector to think differently about how they're solving their problems. And then to also identify across these continuums how you can continuously generate data that will give you insights into how to think differently, and certainly how you could change the way that you perceive solution building in government. So what do we do? At GovEx, we have been very generously funded by Bloomberg Philanthropies to work with 100 mid-sized cities over the last 3 years to build out a foundation of data practice in cities. And so we just celebrated our 100th city last month, so we've hit our goal. We've actually been to over 120 cities where we've done evaluations on their readiness to actually do data work. And then we are investing in their practices. So we're looking at how can we build the public sector capacity to start thinking differently about the role that data and evidence plays in decision making. This is just a map, another view. So we've worked with 100 cities, but when we think about that capacity building, we've actually trained over 1,800 public sector employees in the last 2.5 years on the practice itself. And this is at the program level. These are folks that were not data people when they started working with us, and now we see them as some of the most aggressive data stewards in government. And we also have a small international pilot where we've been doing work all across the UK and in both East and Western Europe, and then obviously we have a project in Canada and one in Buenos Aires, Argentina, which we're going to talk a little bit about, just to give you a feel for our approach and methodology, so you can also see how we are trying to work with different partners. And I wanted to focus on a lot of the health work that we do, because we do have many cities that are focused on health outcomes. And the first one is actually Buenos Aires, which is a wonderful city. I encourage everyone to go and visit. It is amazing. I love it and have been spending a bunch of time there. But when we first went to Buenos Aires, we met with the mayor, and we asked the mayor kind of what are the things that keep you up at night. And he actually had a suite of outcomes that he was measuring. He was sort of like Martin O'Malley on steroids. He was holding 22 stat sessions a week, including a stat room that was built into the lobby of his apartment building. So Josh is like got PTSD in his eyes. But he was convening these meetings all the time, constantly sort of flanked in data and evidence. And one of the one that was keeping him up the most was the health indicators that he had focused in on. And he had set a very ambitious goal that every single resident within the city of Buenos Aires lived within a 15-minute pedestrian commute to their primary healthcare physician. And that they knew who their primary healthcare provider was, and that the primary healthcare provider was able to meet their medical needs at any level. So if you are a young family and have small children, that had to also include a pediatrician, a maternal or OBGYN for any women of childbearing age. If you are an aging community, that you have doctors that are specializing in geriatrics. And if the city of Buenos Aires is actually oriented where most of the poverty rests in the southern part of the city, and the majority of the health providers were in the northern part of the city, and there was very little provider reach in the southern part of the city. And not only was there very little provider reach in the southern part of the city, but their ERs were also overrun and strapped with people relying on them for care that could have easily been handled in local health clinics, even when a local health clinic existed in a catchment area for a particular emergency room department. And so we worked with the city to help map out where all of their health assets were. We worked to sort of refine the goal language around the goal itself. And then we started to create essentially a measurement framework around not only how to redistribute some of those health assets, so moving a lot of the doctors from the north into the southern health clinics, we helped them reestablish some of the health clinics. But one of the big indicators was looking at outcomes that were being driven by patients who were still relying on the emergency departments. And so we started measuring the front door of the emergency departments and the health outcomes for the patients that were going to the local clinics versus those that were going into sort of the deeper end of the health system. Because one of the things that we found in a community engagement survey work that we did with the city was that there was a lot of misperceptions about the quality of care in the local health system versus the emergency room. So adults were more likely to go to the local health clinic to get their health needs met, but the parents of children were more likely to bring children who were not hospital, didn't have needs to be treated in a hospital, but were going to the hospital much more because they didn't trust the pediatric providers in the community. And so we helped the city create a framework for how they would measure the efficacy of both the local health pediatric care delivery and also the hospital. And we were able to go into the communities that were most impacted by this decision making and show them that actually outcomes were much better when children were able to be treated in the local health department, where they were able to see a doctor faster, where they were able to stay home longer, and they was less likely exposed to infection. And so this was all part of the goal to getting people closer to their doctors, but also we're now able to show much better public health outcomes as well as a validation of the work and of the decision making on the goal itself. And if you have any questions, yeah.
Just curious, how were you able to get access to that kind of outcomes? So the outcomes were things like how quickly they were able to return to work and how long they had to stay home and those kinds of things, right? So how did you get out of that kind of?
So
repeat the question. Could you reiterate that?
Yeah, so the question is how we were able to get the data, particularly around the outcomes. It's obviously a lot different when you're working in a public health, when it's a government subsidized health system, because the health department owns a lot of the data, and the hospitals are reliant on the government. So there is a different arrangement in terms of the data itself. But there was a stakeholder group of all of the hospital presidents that committed to the goal itself. The mayor convened that group and said, "This is, we really want to be able to do this work," and they signed essentially a data sharing MOU. So not only were we pulling it out of the citywide system, it's actually a city-county model, but they were also providing actually readily more sort of manually pulled updates. They were also brought into these stat meetings. So the hospital presidents were brought in and sort of held accountable in the same way that, the other public health officials in the city were. But they also were at the table when the project itself was architected. So the idea was that they were stakeholders in the outcomes too. They were complaining about people overusing EDs, that they didn't feel like they had community support by the local health department. And so they were really bought in from the beginning to the idea that we would create this, that the city would create this a view of the data. And they also, for the first time, got a dashboard that compared all the hospitals so they could see how they were doing ranked to all the other hospitals across the city, and they knew which patients they were getting, and they were able to take a slice of the data or see a slice of the data they'd never seen before, which was actually a big added benefit for them. So whenever we're doing this work, we try to figure out what those carrots are, and this was a big carrot for the hospital systems. Any other questions about this one? You can see, okay, so this next one is Florence, Italy. I'm actually going to let Kat walk us through this one. Thanks.
All right, thank you. So I'm Katherine Klosek. I'm Director of Applied Research at GovEx. I began my career as a state stat analyst with Governor O'Malley. So I've been with GovEx since the center opened, so about 3 years now. So the story in Florence, the mayor had actually identified cycling as a priority. There was a plan to expand their bike sharing program, but there were also issues with accidents. So cyclists were getting into accidents, and there was sort of this perception and a little bit of finger pointing and blaming that folks were blaming pedestrians. They were saying tourists in city center are really responsible for these bike accidents, and that's going to make this expansion really difficult. And the mayor really wanted the expansion because more bikes on the street means fewer cars, and people are out, using their bodies, and it creates a healthier population overall. So the GovEx engagement with Florence really encouraged the city to bring together multiple departments who owned various data sets that were related to this issue and actually conduct some hotspot analysis. And this is one of the maps that came out of that analysis. So the legend is in Italian. But basically, it's kind of hard to see. But the red dots, those are all cycling accidents in which a pedestrian was injured. The black dots are where there was a fatality, and blue dots just mean there was an accident, but no one was necessarily hurt or killed. So this showed right off the bat that, in fact, the accidents weren't happening at city center, that they were kind of dispersed throughout the city. And there was other analysis that showed that only about 6% of the accidents were due to pedestrians. So the city was actually able to share that information with the public. They were able to open that data up and achieve their goal of actually getting 10,000 more bikes onto the streets through that bike share expansion. Now everyone's safer, there are fewer accidents, and they're engaging folks in the community with that data to continue to create improvements to their cycling infrastructure, again, for a healthier populace. So we've heard of a few international examples of cities that are looking at access to healthcare, that are looking at infrastructure and the role of infrastructure in public health. We're going to talk now about some examples from the United States of cities that are looking more at social determinants of health. So, yeah. I'm sorry. Yeah.
So, did they? Did you name it? I'm sorry. So if they found that the accidents weren't caused by pedestrians, what were the causes, and how were they able to bring the number down while adding more bikes to the streets?
Unfortunately, it turned out to be automobiles. Yeah, exactly. So they're looking at, another thing that they did was they looked at kind of whether the accident was caused on the road or on a cycling path. And so they're able to build out their cycling paths and that infrastructure in a smarter way. So maybe like farther away from the roads and that type of thing. And obviously those types of improvements take some time. So continuing to monitor that.
So can I add to that too?
Yeah.
Sorry. I'm not going to talk into your chest. So the other, it was automobiles, which actually works to the benefit of a larger goal. So the mayor of Florence wants to make Florence a completely pedestrian city. So shut down the entire historic center to all automobiles. And so this data actually plays a big role in his ability to do that. And it's going to be one of the first, there's a couple of cities in Spain that have already done a complete shutdown. But a big piece of our work there is also measuring an impact of what creating a pedestrian city what health benefits it would create, and then also what environmental benefits would have. And we know now, you looking at this data, that it's already because at the same time they were starting to do automobile restrictions. Kind of like what they have in London, where you have like the congestion tax that you have to pay if you're going to be driving in the center. And so we are monitoring this, and hopefully we'll re-engage when they go to the next phase of actually shutting down a big piece around some of their cultural assets.
Other questions? Thank you. So, as this audience knows well, there's increasing research that shows that to really improve health equity and population health, there needs to be a focus on environmental, economic, and social factors at the community level. And cities are effectively comprised of communities, so they're well poised to address health in this way. We've actually noticed that cities are beginning to kind of take a more holistic look at health. And so I'm going to talk about Kansas City, Missouri. They're at the more advanced end of the maturity scale of cities that are doing performance management. They've been doing it for almost a decade now, which is kind of crazy. They started their performance management program, which they call KC-STAT, based on really high-level priorities set by City Council. So this is one example, neighborhoods and healthy communities. So City Council said this is a priority for us, and then city staff and their performance management department had to figure out what that meant effectively. So the boxes here represent the key performance indicators under neighborhoods and healthy communities. You see that the one in the middle is focused on actually life expectancy by zip code. We'll dig a little bit more into that. So this is what it looks like if you were to sort of click into that box. They have, let me go to this. They display the data in a number of different ways. So there's the chart that we just saw. There's also some spatial analysis that they share with the public. So they're actually mapping it out by zip code, and they're able to show sort of that disparity in life expectancy by zip code. And they're also, it's one thing to understand the problem, but it's another to take action on it. So these are actually some of the objectives that they're trying to achieve in order to move the needle. So they've targeted actually a number of zip codes where life expectancy was actually a lot shorter, and they have a health improvement plan, community health improvement plan that involves key partners from city government and outside city government as well to try to address some of those factors and take that more sort of holistic approach to improving health in communities, and especially in those targeted communities. I'll just talk about one more example. So this is Denton, Texas. So this is a city that is newer to performance management. They actually created their performance management program through an engagement with GovEx in the past couple of years or so. So they too chose to, well, they call them key focus areas, but those are based on city council priorities as well. And one of them is safe, livable, and family-friendly community. So if you dig into this a little bit more, you see that they have a range of factors and goals that they're looking at that range from, public safety, so sort of traditional policing and that type of thing. They're also looking at things like blight. So they're taking kind of a broader look at what it means to be a healthy community, healthy neighborhood. Again, beyond just access to healthcare, there are also goals around sort of cultural programs, and they're including that in their definition of health as well. So those are two, I think, stellar examples of cities that are starting to think about kind of, this holistic approach to health and how to really measure it in a meaningful way. There are some challenges in other cities where they're not sure where to begin with measurement, and so we just say, start with what you can control, take a look at the data and see where the most, salient challenges are, and begin there. What's next for performance management?
How's it sound?
I know.
Sorry, Kevin. So we wanted to have a conversation a little about where we're seeing the field. So we've made a lot of observations. We're 3 years into the work. We've got these projects, and the projects, most of our projects are focused in sort of key buckets of outcome areas. So we do a lot of work around infrastructure, we do a lot of work around transportation, we do a lot of work around sustainability. Crime, policing has been obviously a big issue, not just in Baltimore, but in a number of our cities, and trying to understand how we can influence sort of what policing looks like in the 21st century city. But we're also had the opportunity to do a lot of learning, and a lot of learning, we made a lot of assumptions when we originally designed the program, particularly around open data. We thought that the program, when Bloomberg initially funded us, we were going to be focused on getting cities to share more data with the public, to change the sort of the dialogue between public and government on the platform of open data. And what we learned very quickly when we got in was that most governments had already invested in open data technology, but the data that was in the systems was awful. It was not maintained, it wasn't described well, there were no standards around how it was managed. And when we pulled back the onion even further, we realized there was no comprehensive data practice that existed in city governments. We had the benefit of being sort of raised, I had the benefit of being raised in sort of an O'Malley government where there was a lot of time and attention paid to sort of the standard way that you pulled data out of systems, that you had sort of baseline data for almost every HR function, for a lot of the operational data. It wasn't if you could get it out, it was how frequently you could look at it, and it was pulled out sort of consistently. We had already gone through a lot of normalization, so the data was comparable. And that simply just wasn't happening elsewhere. And so we actually went back to the philanthropies and we said we need to change our entire focus of the grant from open data to this idea that we have to invest in core fundamental data practices. And so a lot of the work that we've done over the last 3 years is established a data practice in cities. So getting data thinkers in mayor's offices to think about how data should be viewed as an enterprise asset and how it should be sort of tended to in that way, both in the way that they procure systems, in the way that they create relationships with vendors who are producing data or collecting data. And at the same time, we've seen this like concept of smart cities sort of evolving. So what's a smart city? And there is sort of the classic definition of a smart city, which is a city that has sensors essentially all over, and you're sort of taking the data from those sensors and it's influencing the way that you go about decision making. So if you think about transportation, you've got sensors all over your transportation, your critical infrastructure, so you know the condition of that infrastructure, you know the flow of traffic, you know the pavement quality, you know a lot of different information can be done in sensors around air quality. So you've got sensors all over the city, you probably can see them, that are monitoring the air quality so that you know. But what we also learned was that a lot of private companies deploy those sensors, and cities don't know what to do with that data. They don't have a regular routine that's built up around taking those inputs and actually influencing policy. So a lot of our work is how do you leverage already deployed sensors, and then how do you prepare yourself for the future? And when I talk about the future, I talk a lot about autonomous vehicles, so driverless cars. If you talk to the manufacturers, the automotive manufacturers, they say 25% of all the fleet will be autonomous in the next 5 years. So what does that mean for cities, right? That means less people will be driving personal cars. Car services like Uber will start having driverless vehicles that will be deployed in their fleets. But they're also moving sensors that are going to be all over our cities, that are going to be collecting that pavement information, that are going to be measuring the flow of traffic. These autonomous vehicles are basically giant data inputs. And so one of the things that we really focus on how do you create advocacy within city governments so that you can make sure that you're taking all the data that's coming out of those AVs and you're letting it influence your policy in a way so that you can save money, so you're not investing in surface engineering. So you're not thinking about lane marcation if lane marcation is going to be obsolete in the next decade, and what does it look like, and really making government sort of a stakeholder in the future instead of being led by the automotive industry. And we're seeing that not just with AVs, we're seeing it with the smart city sensors, but also we're seeing it with everyone basically collecting data themselves, right? So if you think about our sort of utopic data-driven city of the future, you've got almost right now 40% of the people that live in your cities have a Fitbit or a phone that they use for fitness tracking. So you know where your people are, you know how active your people are. How can you use that data to influence other decision making? So if you haven't met your steps, can you then also provide your user with addresses of the nearest park where they could quickly go out and get those additional steps in? Or if their caloric intake is varied, do you partner them with a public health nutritionist? If they're not getting out enough, do you have someone go and coach them into getting out more, or giving them information about how to access different resources? Our phones are also creating huge data sets that are open and available. People are very much ready to give up their rights. And so if you've ever signed up for any application on your phone, you quickly go through your terms and conditions. And that terms and conditions is actually allowing your phone to produce tons of data that can be shared. And so what are cities doing to actually access the back ends of those systems to help influence the way that they engage people in discourse and thinking? And so we're helping cities think about that, the integration of that sort of private data and public data. Josh, did you have a question?
Yes, I have one question, which is one of the things in this discussion of performance management and public health is that you're looking at data at the city level. It's at a community level. So that is, not just one person at a time. You're aggregating it So it's that resonates with public health. But on the other hand, we think more in terms of research than performance measurements say.
Right.
How do you think about, and a researcher might say you're tracking the overall experience of the population, but not really looking at whether this is, an official comparison group, or, how do you think about the intersection between performance measurements, say, and research?
Well, so this is like this is exactly kind of where analytics leads us to, right? So for us, the intersection is in the methods. So you've got this sort of traditional performance management, which is data coming in, you're looking at data, every 2 weeks, you're looking at the data set, you're looking to see what's working, what's not working, and then you're trying to figure out where you do interventions to get it moving in the right direction. But then we've gotten to this point now where sort of that low-hanging fruit is gone, and we know that you can bring in these other interventions. And so our partnerships with researchers is really about, let's not only craft the intervention, but let's craft the measurement framework to see whether or not the intervention is effective, and then let's create the rhythm or the routine of making sure that we're moving in the right direction, right? And so that has been largely absent from traditional performance management. Government still suffers from, creating really comprehensive program design that doesn't have evaluation starting from the very beginning, or that doesn't, look at A/B testing or lower cost evaluation and only calls for really comprehensive evaluation that is oftentimes takes a long time, is very expensive, and it's just once. And it's just once at the end of a program. So if your program is bombing out, your program is bombing out. But if your evaluation isn't scheduled to happen until after you spend all your money, then you're screwing yourself, and you're screwing the people that you're meant to be helping. And so for us, the real benefit of having research partner from the very beginning, from ideation, from let's help first government scope a problem, which we find to be one of the biggest missing skills in government, which is the ability for government, for the public sector worker in the program. They know exactly what the need is, or whether or not it's funded, or whether or not it's resourced appropriately in other ways, but they don't know how to articulate their needs in a way that enables research, a research partner, and they also don't know how to articulate their need in a way that instigates the right technology interventions. And so you end up getting these massive technology systems that are like hammers killing ants. And then you end up having these research partners that come in and want to do these long, protracted evaluations that don't provide any insights until after all the money's been spent. And you end up spending all of your money in the wrong places. And so what we're seeing in sort of the real sort of beauty of these is this partnership at ideation through the course of programs, so that you're able to adjust and make sure that you're actually maximizing the benefit of the intervention, or that you're abandoning interventions that aren't working and you're doubling down on those that are.
So it sounds like you're really entering in a phase where there's a lot of engagement with research, but the research can't be the super traditional research. It has to be able to move at the pace of performance management.
Yeah, and that's why I love working with practitioners that have come into research, right? And people that understand sort of the pace of business, particularly at the government level, and also we're seeing testing done a lot more. So A/B testing is actually part of the What Works Cities program, and a lot of our cities are now learning how to do A/B tests and low-cost evaluation. So there's a great example that we used in San Jose, California, where it was like bulk trash pickup, right? Everyone knows what bulk trash pickup is. San Jose had this like $2 million bulk trash pickup program, and no one was using it. But they had like neighborhoods that were constantly littered with huge like pieces of trash, so like a couch or a mattress or whatever. And so they couldn't get people to use it, and so they sent out, they created. We helped them with our partners at the Behavioral Insights team. We helped them create a test that basically was like, send out a postcard that tells people like, your neighborhood would be much safer if there was less trash around, and if you want to make your neighborhood safer, then use this service. And then we sent out another card that said, you've been selected a winner. You get 1 free bulk trash pickup. If you've got bulk trash, put it out on, and you call this number, put it out. And then the other one was, your children need to get to school safer, and it turns out like everyone loves to win something. Like 25% more people took advantage of the service because they thought that they had won something, and the bulk trash service is now sort of being maximized. So now taking that same test and repeating it across a number of different service outcomes. And so the idea here is that like you can do this type of evaluation and testing at the very beginning or the inception of a program, or to bail out a program that you really need to be successful that's not, but you have to have the skills in your government to do it. And so the idea for our work is to invest in those skills. Yep.
I love your idea of accessing all of this tons and tons of privately acquired data. And I'm wondering, is that actually something that these private companies such as Uber and Tesla or the phones, are they willing to share those data?
So this is the fight that I'm fighting, right? So this is our whole position is that like they shouldn't. It's not should they be willing, that it should be an exchange for Uber. If you want to operate in our city, you have to. The exchange is you have to provide this data. And so Uber and Lyft and actually Waze is another great example. Waze is one of the best public sector partners because they not only they've created these data sharing agreements with cities. So if you are a Waze user, not only do you see kind of where traffic is, but if there's planned construction along your route. And Waze has agreed to take all the construction capital planning plans from their cities and integrate them into their app. So they know in advance when projects are going to start, and they're going to start rerouting you around where there's going to be closures. And they're working with cities in that way to help change the flow of traffic so people start getting accustomed to new routes when there's going to be big disruptions. But not only that, they partner with cities on emergency management planning. So if there is a flood, like when there was the big hurricane in Florida, Waze was a partner that was helping to make sure that the flow of traffic was going in the right direction so people were getting out appropriately. But Uber is like, a bully in a lot of ways. And so they're one of the big companies that's, they're testing autonomous vehicles. And actually the state of California had a big pilot by Caitlin that had a big pilot for AVs in their communities. And the government said, it's fine, you can pilot in our cities, but we need you to give us the override data. So they wanted to know how many times the pilot of the AV had to override the machine in order to take over because the car was going to hit someone or hit something. And they refused to provide that data. They said that it would make, it was a competitive issue. And so for us, like that's a huge red flag that they're not willing to partner with us. And the safety and our decision making around whether we let AVs deploy in our cities has to be based on this trust that we're building. And so they shut down all the pilots in the state of California, but the state of Arizona was like, oh, well, we're open for business. You can come and do all of your piloting here. And so Uber just moved to a different state. So a lot of the work that we're doing is like, how do we enable that sort of advocacy? Because it's not just about the overrides, which is probably the single most important data set that you're going to get in the AV testing phase. But eventually, like I said, those cars are collecting, like we work for the state. We spent billions of dollars on these like rovers that drove over pavement and produced like an annual pavement score for all of our roads. But now, because AVs, and even my car and cars that you're driving now, they're already measuring the pavement. They know exactly kind of the quality of pavement. They know how to adjust suspension on particular roads that are on your path. That's already sort of built into the modern engineering of vehicles. And so how do you extract that data so you don't have to pay the billions of dollars to do your system safety and preservation scans? Those are the types of things that we're trying to build a capacity for. But I think there are plenty of people that are willing to do it. The problem is that government isn't necessarily poised to ask the right questions or to create the framework to get the data. And so a lot of our work is really how do we build that capacity so that in the procurements, in contract negotiations, in these testing relationships, government is advocating for the right. Any other questions? Yeah, I think that might be it. So thanks. Like I said, we're here. We're on the Homewood campus. And we also hire interns every semester. So if any of your students, and you don't have to be located in Baltimore, so I know that there's a lot of students that are, we have city projects going on in nearly every state, except for 2.
Montana.
Yeah, Montana and Idaho. Oh no, we do have Idaho now. Yeah, so I think it's just 1 state. So if you're interested, we'd be happy to engage, and we'll continue obviously to work. So thanks so much.
Thank you.